Center Houston School of Public Health at the Austin campus. And I'll serve as the moderator today for the 7th in our series of, in our summer webinar series of focusing on physical activity and public health planning for the future. We have a remarkable guest speaker here with us today to talk about transportation, land use, and community design as it relates to physical activity. As I mentioned, this is the 7th in our summer webinar series. Wouldn't have been, at least this whole series wouldn't have been possible without the support of UT School of Public Health and the Michael and Susan Dell Center for Healthy Living, where I have a professional home, but also the state of Texas Department of State Health Services, as well as the U.S. National Physical Activity Alliance, which is a fairly new organization that under which the U.S. National Physical Activity Plan sits. So we'll get started here. Excuse me. A couple of assumptions that we're operating with here. Planning is central to public health. You don't know where you're going unless you have a plan. You don't know how you've gotten there unless you have a plan. And you don't really know if you've gotten there unless you have a plan. And evaluating how well you've gotten there. So public health planning is kind of central to everything we do in public health. And I'm a big proponent of this as a tool as we seek to improve population health. Many might not know, but in 2008, we released the first Texas state physical activity plan, focusing again on physical activity in public as a public health priority. We called it Active Texas 2020. It was sponsored by the Texas Governor's Council on Physical Fitness at the time. And it actually predated the U.S. National Physical Activity Plan, which I was particularly pleased about. But at the same time, there's limitations in that the national plan took a much more comprehensive approach to societal sectors, where we live, where we work, where we play, where we pray, and has brought together strategies, tactics, and objectives in each of those societal sectors to be able to help people, help organizations, help all of us become more physically active. So we are revising, again, with the support of the Texas Department of State Health Services, revising Active Texas 2020 into Active Texas 2030. Texas and West Virginia remain the only two states with standalone physical activity plans of note, which I'm particularly pleased about. And what that does is it takes physical activity out of traditional chronic disease plans or obesity plans, other kind of things, and makes it a priority for improving the health of populations. I believe that's where we need to go with all 50 states and 7 territories around the country. So our goal is to bring it in the state plan, to bring it in alignment with the sector-based approach of the national plan. And the purpose of these seminars is to engage stakeholders, engage people at local, state, community leaders, and so forth, because all health is, in fact, local. You can have the best laid national planning that comes out of CDC or other places, but if it doesn't take into account geography, culture, and other kind of things, it's probably not going to be applicable. So planning for what may be needed in El Paso or along the U.S.-Mexico border in Texas or in the Panhandle are all going to be different. And I think the questions of the day for these webinars has been, how do we articulate these national strategies and tactics to local implementation? The U.S. National Physical Activity Plan has 10 sectors. Again, this is our 7th in the series. Yesterday we had faith-based settings, and I'm really pleased that today we're going to be focusing on on transportation, land use, and community design as the sector many of us, most of us, virtually all of us, deal with transportation and community design every day, and we all live and cross through this sector. So it's highly applicable, I think. Our speaker, we're extremely pleased to have such a prominent national leader in this area, is Dr. Melissa Bopp, who's in the Department of Kinesiology at the Pennsylvania State University. She serves as the, in addition to all of her responsibilities in her academic life, she serves as the chair of the sector standing committee on transportation, land use, and community design. We're extremely fortunate to have her today to kind of lead this discussion. And so, Melissa, you are welcome, and thank you for joining us. You're welcome now to take the control and bring your slides up and lead us through what you have to say today. Thank you again for being here.
Well, thanks everyone. I'm excited to be here today to share a little bit about this topic with you. I do thank Bill for a great introduction. As he said, I'm a researcher and a faculty member at Penn State, but I work really closely with practitioners like yourselves on a lot of different levels. And I often say that I'm envious of many of you because you're the boots on the ground that I don't get to be as often as I would like. So as Bill said, I'm currently the chair of the Transportation, Land Use, and Community Design sector for the plan. I've been involved with the plan for almost a decade now. My research and outreach activities have been focused on active transportation, and I've written many books, articles, reports on active transportation and what influences this behavior. Something else, I've had a long-standing relationship with the League of American Bicyclists focused on their Bicycle Friendly America program as well as some of their policy initiatives. And my research has also had a long-standing focus on equity and addressing the needs and concerns of all groups of the population. And I'm going to try to weave that throughout my presentation with you all today. So I don't have a terribly long amount of time with you all today, so my outline is fairly brief. The first thing that we'll go over is some of the basics of active transportation, talk a little bit about who is participating and examining how rates of active travel may vary by race, ethnicity, education, income, or location. And then we'll dive into some of the strategies the National Physical Activity Plan has laid out. I'll do my best to describe how we can translate them for implementation in your community, your region, or across the state and put things into action. And I'll try to hit on who may be the major stakeholders for each of the different strategies and tactics. So I realize that many of you deal with active transportation on a daily basis, and it may need no clarification, but I just like to get everybody on the same page. Active transportation is basically, or sometimes we refer to it as active travel, refers to walking and biking for transportation, to travel to work, to school, to run errands, to shop, or just to go somewhere as a purposeful trip. And I'm sure you all at this point, after, this is your 7th webinar, don't need to review the benefits of active transportation. But we do know that they're extensive and very much on par with the benefits that you've probably heard about in terms of leisure time physical activity. So lots of physical and mental health benefits, as well as a decreased risk for chronic disease, things like cardiovascular disease or diabetes. So, but beyond that, I get to talk a little bit more about some of the other benefits that we know are tied to active transportation for communities. And that can include things like less traffic, pollution, and emissions, which has its own health benefits. And we see those benefits in the communities with greater active travel, and communities that support more active transport and are more walkable and bikeable typically have greater economic activity going on and higher property values. Now, to tie together all of the pieces of our sector's titles. So when we refer to land use and community design, in its very simplest terms, it means how our communities are laid out and how the citizens of the community interact with those spaces. Now, if you take a minute and think about your own communities, there are going to be parts where there is mostly housing, parts where there is mostly commercial, parts where it's mostly industrial, and then maybe some parts that serve the community like parks or green spaces. Now, sometimes there are a little bit of spaces where everything is all mixed together. And we refer to this as mixed or diverse land use. So think about it, maybe you have an apartment building on the same block as an office building with a cafe and a city park. This kind of lively space provides some different types of destinations that are easily accessible via walking and biking. And things like crosswalks, sidewalks, bike lanes, or trails help to make all of this safe and accessible. We do know that these different kinds of diverse land use spaces, they're very highly desirable, and they can contribute to a better quality of life. And as I mentioned earlier, are often tied to greater economic activity and property values as well. Well, we know that active travel is important, so let's take a look to see who's doing it. So the short answer is not many individuals, and there are certainly disparities in who's doing it and who's not. So national data from the National Household Travel Survey, which is just one of the data collection systems we use to judge and assess this behavior, puts the estimate of non-exercise walking or biking on any given day at about 18.5%. Now, most of our trends are fairly consistent to show that men are more likely to actively travel than women, and younger individuals actively travel more so than older individuals. Now, despite these rates, we see that the potential is really there. Many trips in the US are short, less than 1 mile, or even less than 3 miles, but most are driven. So this graph is looking specifically at those who walk to work. Sometimes we refer to this as active commuting, just like you commute with your car. Active commuting is walking or biking to work. So here you can see a downward trend in rates of walking to work from the 1970s. Now, rates of biking to work have remained abysmally low nationally for quite a long time, but they're, I mean, I guess we could call that stable, right? So let's look at how rates are in some different populations. This here is a graph looking at rates of walking, biking, and transit trips for low-income individuals. So if we look here at the percent of trips by each of these different modes of travel, we can see a decline since 2009 for walking and transit, but a really slight uptick here in bike trips. Now, there's an interesting relationship between income and biking and walking to work. So as you see on the graph here, rates are higher at the lower income levels for both walking and biking to work, likely as a result of either access to other modes of travel or to address some of the high costs of commuting by car, as certainly we would know about right now. And then rates of active travel decrease with an increase in income until the highest income levels. So at the lower income levels, the decisions for walking and biking to work are driven by more likely necessity and economics, while at the highest income levels, walking and biking to work are more likely a conscious choice and driven by other motivating factors. Now to look at active travel to work by racial or ethnic group, we do see some notable differences here. And I want you to remember these statistics as we look at some of these upcoming slides here. Overall rates of biking are low across the groups, but rates of walking are lowest for whites and highest for those who report as Asian or two or more races. So let's bring this around and look at safety and fatalities. So the most dangerous states for pedestrian fatalities are shown on the map here. So, and you can see here, Texas is number 12. So you're not in the top 10, but you are in the top 20. So, and noticing that the majority of these states are in the southern half of the United States. Now, over here on the right, this shows that Things have been bad for these states since early 2010s, and they really haven't gotten any better. In fact, they've gotten worse. So no improvements whatsoever for any of these states in terms of fatalities. And then tying to some of my previous points, rates of pedestrian fatalities are much higher in lower income areas, which is concerning given the high rates of walking amongst lower income populations, as I just showed to you a couple of slides ago here. So you see the highest rates of fatality occurring at the lowest income group compared to the highest rates of income. And additionally, we see much higher rates of pedestrian fatalities among Native Americans and among Black or African Americans. So this is a disproportionate burden relative certainly to the amount of travel that's happening. So what can we do to address some of these low rates of active travel and some of the disparities that we've noted among the different populations? So our sector, the strategies have outlined a number of possible approaches that can be implemented by key stakeholders and organizations much like yourselves. So what I'll do with all of the strategies is to provide an overarching summary of the strategy and then outline some tactics that could be used. Now, what I'll do is try to hit on some best approaches to operationalize things, and then maybe provide you with a couple of ideas or some inspiration about how it could apply to you and to your organization. All right, so let's talk about the first strategy, which is mostly focused on planning. This particular strategy is focused on how to incorporate active design strategies into different communities. Now, every state is different in how they approach planning. For example, here in Pennsylvania, we have a lot of smaller townships that all kind of gather together and then end up doing some regional planning. And this works really well for Pennsylvania because of connectedness issues, shared roads, shared resources, common destinations like schools, large resources, like parks or employers, different commercial spaces that are frequented by people in connecting communities. Now, that may not be the norm in Texas, or may not work logistically because simply the vastness of your state, but it may be in places where it is possible and may be worth thinking about planning as a region for active transportation for some of these reasons. Planning can include creating policies or ordinances surrounding complete streets strategies, which address active travel for all users and all modes of transportation. Bicycle and pedestrian plans are great tools for guiding development, for guiding improvements and resource allocation. Typically, these are developed with multiple stakeholders and consider many different aspects of walking and cycling in your community. Local and regional plans oftentimes cover a multitude of topics. They're not typically just focused on walking and biking. And they oftentimes can address the implementation of supportive infrastructure for walking and biking as a part of a greater plan for mobility, for transportation, for economic improvement, or maybe some other overarching plan goal. So the most common players with planning are the usual suspects, our planning organizations, regional stakeholders, advocacy groups, and of course local government tend to be the ones that we look to for help with these things. All right, so let's go into some of the specific tactics that the plan has outlined for strategy 1. So I'm not going to read any of the tactics in detail. I feel like you all can cover that, or you can certainly visit it on the plan's website. But what I'm hoping to do is kind of interpret the tactics into maybe a little bit more user-friendly language, if you may. So this first tactic is focused on getting walking and biking included as a part of the overall planning process that happens at either local or regional level. So perhaps this is part of a larger plan, maybe that includes a focus that is mostly motorized travel or traffic plans, sometimes they refer to them as, or addressing how walkable and bikeable community aspects could help create better economic opportunities in an area. So basically, this is just a push to be sure that active travel are mentioned within plans, and then hopefully include some of the active design principles where appropriate. So for those of you who are maybe already involved in planning, you can advocate for more of a focus on walking and biking. And for those of you who are not involved in planning, maybe this would be a place where you could reach out to other stakeholders who maybe are and see how you can advocate for more walking and biking in the different kinds of planning that are maybe happening in your area, be it related to transportation overall, maybe for economic or other kinds of things. So this next strategy tactic here is focused on buildings, and this could include promoting building design that supports walking and biking. So that could include things like the provision of adequate bike parking or locker rooms. This tactic would need to involve stakeholders in local or regional building code offices, and maybe developers or builders would be some key folks to bring into this conversation as well. So I've heard some great examples from communities across the country where they put in place for new office buildings, any office building that was going to have more than X number of offices had to include a locker room where people could shower after walking and biking on their way to work, and then having an adequate number of biking spaces, just as they would be adequate, talking about adequate parking access. And speaking of parking, this tactic is maybe a little bit of a tough sell. So research has shown us that the higher the rates of parking there are, typically that tends to lead to less driving and more walking, biking, and transit use when traveling to a particular area. But higher parking costs are not an easy thing to promote. And to move forward with this, you may want to think about doing something like spending studies, which examine how people travel to an area like a downtown or a commercial space, how often they come and how much they might spend when they come. This may help in uh, selling strategies to local policymakers. So in State College, where I am, we did a quick version of this when the Downtown Improvement District was debating about replacing one single parking space with a set of bike racks. So one parking space versus a set of 6 parking spots. And we did a little spending study, and we found that those who come to the area via foot or by bicycle spend more over an average month than those who come by car. So at that point, after we presented the evidence back to the Downtown Improvement District, it really kind of became a non-issue to replace that one spot of a car for a spot for 6 bicycles. So, and proud to say that was, I think, 8 years ago that we did that, and the bikes still get the claim of that particular parking spot. All right, so moving on to strategy 2. This is focused on the land use and community design aspect of this sector. So this refers to putting in place zoning laws to create those diverse spaces that I talked about when we were first talking about this. So we're trying to create diverse destinations. Now, thinking back to those stats that I shared about short trips, this is really about having those places to walk or bike within a reasonable distance. So this is going to, again, concern your local and regional planners and governments, as well as those who maybe address economic development. Having housing entities on board could be helpful here as well. So this tactic here in this first one in strategy 2 speaks directly to zoning and creating spaces in your community for mixed use zoning. This is where we have residential, different types of residential in particular, so like townhouses, apartment houses, as well as single family homes, commercial spaces, all intermingled to help create those destinations that we know is shown to increase walking and biking trips. For this, you would have to probably get local or regional planners on board to address maybe a bigger vision related to planning. and then determine if local laws would need to be adapted or changed to allow for it. So the key tactics for the key players for this tactic are likely going to be planners as well as possibly your local government, be it city or township or possibly even county. Now, again, the strategy is focused on zoning laws, and to address this at a larger level, you're going to likely need some good examples about how this has maybe resulted in economic gain or positive outcomes in maybe other communities like yours to show how this could be a worthwhile approach when you're trying to make this selling point to local legislators and lawmakers. So the stakeholders who plan to make laws around zoning would be the key players here. But your economic developers should be a part of this conversation as well. Thinking back to what I said about walkable, bikeable communities having greater economic activity happening. So this last tactic for strategy 2 is trying to attempt to address some of the inequities that happen when we have economic development. There's often great debate on creating infrastructure to support walking and biking in low income neighborhoods and how that can actually lead down a negative path of gentrification um, and forcing out lower income long-term residents with new development and investment happening in a neighborhood. So this tactic attempts to prevent it by being mindful and planful and aware of this potential. So stakeholders in this would maybe need to be economic development agencies, and neighborhood groups would be a key partner here to be a voice at the table in any kind of zoning questions or planning questions that are happening in a particular neighborhood. All right, on to our third strategy. This is focused on funding and resource allocation. So we all have an idea of what supportive infrastructure looks like for walking and biking. Things like bike lanes and trails and sidewalks, crosswalks, traffic calmings, other things like that. And of course, we know that that typically requires a significant investment. So this strategy is focused on how to fund these things. Now, every region is going to be different in terms of places to access funding or how to create a different revenue stream to fund these particular improvements. There are great examples out there of different ordinances or taxes that have been put in place to help with these. So it's going to need to be local level specific. I think this is one of those places where having several stakeholders come together and collaborate can generate a lot of really good results. So stakeholders may be on board for different reasons, but maybe all want the same goal. So for example, a health agency or many of you may be interested in some of these efforts to decrease rates of physical inactivity, while a local environmental group may be interested in decreasing pollution and congestion, while a housing developer is interested in boosting their housing value. So this kind of diverse team where everybody comes to the table for a different reason can still result in some really positive things. And you're going to end up with a much stronger proposal for any kind of funding request that you're maybe making than a single group really just reaching out on its own. So this is really where you're thinking creatively with your partner. So maybe your local conservation group isn't a group that you typically think about working with. You know, that the people who, you know, save the whales and, you know, make sure that the butterflies are protected in the forest that the trail runs through, right? But you know, these folks may have a lot to bring to the table and have some of their own data and information as well. So for strategy 3 tactics focused on funding, this one is focused on, this first tactic is focused on equitable access and thinking about the kinds of infrastructure investments that provide opportunities for all. So again, thinking about some great opportunities for collaborative relationships here. This could include disability advocacy groups, transit equity organizations, maybe retired or older adult groups as well. And of course, I think this is a great spot to bring in your local bike and pedestrian coalitions to help try to address some of the safe opportunities for active transportation. So again, here, thinking about equity, this tactic highlights some of the statistics that I mentioned earlier in terms of higher rates of pedestrian fatalities. So this is really referring to addressing the capacity for underserved and under-resourced neighborhoods and communities. This would be a great opportunity for stakeholders to provide training and assistance, seeking for those who are seeking out resources for improving infrastructure, assisting local community groups to make those improvements. So this is very much a capacity building, and thinking about capacity building on an equitable level. So rural communities, low-income communities, communities of color, maybe needing additional support and technical assistance, and what can other stakeholders do to support them in those efforts. So these last two strategies, two tactics for strategy 3, are going to require some larger collaborations to be able to target some of the state level issues. So for example, the State Department of Transportation would need to be involved in decision making around funding, but certainly stakeholders can help in providing quality data to help with the decision making, and getting the information in front of the people who make the decisions. Local watchdog groups can also help to ensure that federal funding that's allocated to the state level include walking and cycling at the rate and the amount that they should. Now, there are some good examples of tax incentives for promoting walking and biking at the federal level. So certainly, those kinds of adjustments can be addressed for possibly an examination of similar options at a state level, maybe with a little bit of encouragement from people with some data and some information, and willing to put in the time and advocate. So strategy 4 is focused on one of my favorite things, data. So data is always a key component. I can't stress this enough. Key component in any kind of large scale effort. So perhaps your group or agency is already involved in a form of data collection, but you don't include any metrics related to active travel. Here's your chance, right? This is another spot where there can be many stakeholders to bring together different pieces of data. And if there are many stakeholders gathering information, it would be advisable, essential almost, to have a clearinghouse of information so that you could organize the information and turn it into usable chunks so that you can then help support some of the tactics that we've already talked about. And this is going to be key for helping show need and helping to show disparities. So if we're looking to address those kinds of things with our efforts. So this first tactic is focused on gathering local level data for active transportation patterns. And I want to make a pitch here for gathering appropriate demographics whenever you can, wherever possible. Please think about age, think about gender, think about race, ethnicity, income, and ability level. All of these are going to help us to understand disparities and provide us with some insight on where we can focus our efforts. So I have a picture here of a bike counter in Boulder that is used to keep track of local cyclist activity in a very visible way on a daily basis. But it can also serve as an encouragement tool to the community as well, and create some conversation and creates some social and community norms. You know, this picture was taken at, I think, 9 o'clock in the morning, and 58 cyclists had gone past that particular spot there in Boulder. At the end of the day, when you go past it, the count will probably be up around 200 or 300. So cyclists begin to feel like, oh, I'm not alone in my efforts. There's lots of other people who are out there doing the same thing that I'm doing. This top tactic here could be tied to planning efforts and whatever your community's goals are for active travel. So engaging some of the key stakeholders we mentioned earlier for developmenting, implementing, just gathering those new sources of information. This is going to be important to spend a little bit of time on to help gauge the effectiveness of any efforts that you've put in place. It's always good to be able to say, we did X and this was the result, right? This helps you to be able to show what kind of bang for your buck you got with any kind of investment resources, the investment of resources that you put forth. You put a new policy in place, put new infrastructure in place, being able to show before and after is tremendously valuable, and it gives you kind of a little bit of ammunition for moving forward. Now, performance metrics for your community is probably going to depend on the stakeholders that you have interested in active transportation, and may be related to traffic rates or congestion, fatalities, crashes, health outcomes, or even just active travel in general. So lots of potential there in that performance metrics and bringing together those stakeholders. So something we haven't really talked about up until now is multimodal trips. And this refers to trips that use more than one form of travel. So for example, somebody may walk a half a mile from their home to a bus stop, ride the bus for 2 miles, then get off and walk half a mile to work. So if your performance metrics don't ask about multiple modes of travel, you're not going to capture the whole picture. You may incorrectly classify this person as a non-active traveler. So therein the importance of considering different ways of assessing active travel. So again, all under that kind of data umbrella here, when you're asking your questions, thinking about these kinds of things. Oh, sorry. So our last strategy is focused on programming efforts and campaigns to promote active travel. This is a little more focused on the actual behavior of walking and biking, but there are still lots of possible stakeholders who can contribute in a variety of different ways. And likely we're looking to the partners who are good at delivering programming or building campaigns around other kinds of health related topics. So our state and local health departments are probably going to be a great partner here. And our transportation agencies maybe can be involved in innovative ways as well. So this first tactic encourages you to use existing tools. So I can't imagine in this 7th webinar here that I would be the first one to say used evidence-based strategies, right? I'm fairly certain somebody else has said this to you at this point, right? So there are great tools out there that you can use to encourage active transportation that are already existing and just need to be maybe slightly adapted to your own communities. This could include kind of out of the box events or messaging around things like maybe National Bike Month, safe routes to school, walking school buses, things like that. There are wonderful evidence-based tools out there that can be used and adapted to be delivered to a variety of settings and populations at a local level. So the key partners here would be those who are capable of delivering and implementing programs or campaigns. So this second tactic here is related to bike sharing, and it's evolved quite a bit over the pandemic. Many bike sharing programs have collapsed throughout the shutdown and have limited access in some different communities. Nonetheless, bike shares still do provide an opportunity for expanded access for bicycles for those who don't own a bicycle. And there are some great examples out there for programs that enhance access for low-income populations and help to remove the bike share, the financial barrier that's tied to many bike shares. So I've heard some great stories about different housing developments that have been able to secure free memberships to bike shares to allow people who live in public housing to be able to take bike shares and commute to where they need to go and things like that. So local government and private corporations oftentimes are the normal stakeholders for bike share, but depending on the different communities you may be in, there may be other partners to look to for this. So these are two of my favorite tactics. And these two organizations, the League of American Bicyclists organizes the bicycle-friendly programs, and National Safe Routes to School office both have tremendous resources to be able to tap into, and they're widely available to any stakeholder who may be interested. These types of efforts are among the most downstream of everything that we talked about, and they're a little bit more tangible. I mean, I've been out here talking about plans and zoning and things like that. This is programming. This is more focused on education and encouragement surrounding walking and biking. So schools, universities, employers, all would be fantastic partners to be able to engage here for these kinds of efforts. So this next tactic is focused on safety and helping to address some of the data that I talked about earlier on crashes and fatalities. So there are nice examples out there for educational strategies for drivers to help them become more aware of bicyclists, different kinds of share the road campaigns and things like that. There are some exemplary skill-based training programs that can help build road skills for bicyclists. Schools, again, a great stakeholder to target with some of these efforts, either in driver's education for driver training or to help students build skills. So I always like to point to Washington, D.C.'s school district. They have a great program for building students' skills and abilities surrounding cycling that they embed into their PE program. So, and for driver training, I always like to brag about this because it was just the greatest example of how just having the right people in the room to have a conversation really made a big difference. So at a local bike coalition meeting, we were talking about ways to increase our own bicycle safety here in town. And it just so happened that the person who ran the driver's ed program at our local high school, we only have one high school here in very small State College, Pennsylvania. It's a big high school, but still there's only one, but he's an avid biker. So what he did is he asked our town's bike coordinator to come and visit our driver's ed classes and do a session on bike safety. Bike Illinois does a really nice driver education set of modules and things like that. All they did was adapt that. And so every semester, the local bike coordinator goes out to the high school and delivers this bike safety training to teach young drivers on how to share the road. So that's been going on now for about 6 years. And so basically that's more than 4,000 students who have received content on how to effectively share the road in our town. So, and all stemming from just having the right people in the room at the right time. And lastly, these two tactics focused on promotional efforts. So the top one really pushes advocacy. So tapping into some of your cyclist and pedestrian groups would be good to take this one on. And getting the information in their hands from our strategy for data gathering to help advocate for all cyclists. So and this last tactic that I'm going to share with you today is maybe for some of you who are out there who are already pushing and selling physical activity as a part of your organization's mission or part of your programming, to think about physical activity as broadly as possible and to broaden your message. Transportation related physical activity, excuse me, is just as effective for health outcomes as taking a walk for leisure. So thinking about ourselves when we use our examples when we're trying to talk with patients, clients, community members, whomever we might be interacting with, to remind them that walking to work is just as good as going for a 30-minute walk in your leisure time. So we covered a lot here. So I'm sorry if I've been a little overwhelming. Let me take a minute just to summarize a couple of points. I feel like we've stressed the key role that active transportation can play for a variety of different reasons. We've talked about a lot of different strategies today, and you don't need to target all of them at once, right? Work with your partners and determine where your lowest hanging fruit are, right? We talked about a lot of different things today. What's going to be the easiest thing to take and go hit the ground running with? Where could you make a difference, right? These are all just ideas. It's not a must do all type of thing. So, and I hope that I really stress the importance of thinking creatively about who your partners could be, and really noting that having multiple partners on board is going to be really important. So that famous quote, teamwork makes the dream work, right? Am I right? So um, I'll leave it at that, and give you the opportunity to ask some questions and things like that. So my email address is there. I'm always happy to answer some questions if you may have them as things pop up and stuff like that, or provide examples. I can point to some different things that I spoke about in a bit more detail. So I'll leave it there.
Melissa, thank you so very much. What a comprehensive view at a huge topic. I don't know how you did it in 30 minutes.
I didn't breathe mostly, so.
I happen to believe, and I've gone on record saying this, that the transportation area is the one area where we're going to be able to move the needle to improve the number of people meeting physical activity guidelines. Leisure time physical activity has been fairly consistent over time. We're certainly not getting a lot of occupational activity these days as jobs have become more sedentary, and trying to figure out how to implement some of these strategies and tactics to increase physical activity related to transportation is certainly an enormous question. It involves reorienting our communities and our transportation networks and so forth. If you would release your share, I can bring up a couple of questions to start us off with. We've got 12 minutes or so. And again, if you have a question, we're a small enough group, you can raise your hand or open your mic or post it in the chat box here, because we would like to get to some of the pressing questions. One of the things I was just fascinated by that bike counter, and the fact that it provides not only data and surveillance, if you will, in a informal kind of way, but it also provides some social support for bicyclists. That was a cool idea that I think should be able to be replicated quite broadly, even for pedestrian use and so forth. So as we're engaging people in and around the state, and stakeholders have a vast responsibility here in this huge topic. You talked about the lowest hanging fruit. You got a peek at my questions here, maybe, but you suggested that folk try to find the lowest hanging fruit from all the strategies and tactics, that you presented, changing laws and developing coalitions and partnerships, which, quite truthfully, leads into other sectors in the National Physical Activity Plan, particularly business and industry and others. If you were faced with a question, which one is the lowest hanging fruit for me to start with, of the strategies that your sector is focusing on, what would you say, Melissa?
That's a great question. And, we work with bicycle coalitions and with universities that are looking to enhance their bicycle friendliness all the time. And I always like to make, so when you talk about kind of the pillars or the framework surrounding bicycle friendliness or pedestrian friendliness, the League of American Bicyclists and Safe Routes to School use kind of this framework called the E's. So engineering, education, encouragement, evaluation, and equity is a piece that has been added in recent years. So I always make the point that engineering is expensive. Education and encouragement typically are not. And a lot of health related agencies are already pretty good at delivering campaigns, messages surrounding a particular health behavior, whether it's a breastfeeding campaign, an immunization outreach effort, whatever it may be. Active travel is just one more behavior to promote and to push and to think about those educational and encouragement strategies. I would always kind of say that's a low-hanging fruit and a good place to start. So, and there you can draw from some great evidence-based strategies that are out there.
Yeah, and it seems to me other people in other sectors, if they self-identify in other sectors such as public health or business and industry or parks and recreation, even we heard this week about faith-based settings, can identify those things. That's a great analogy, I think. There are very few people who will argue that breastfeeding is appropriate and should be promoted if possible for new mothers. With the same kind of recognition and promotion of active transportation, whether it's the last mile, as you pointed out, with public transportation, or just taking advantage of things such as walk to school programs, walk and bike to school programs, and getting those messages out does seem to be, the building blocks are already there, and that it's at least one way to start that process, I guess. But what about barriers? I mean, it just seems to me to be not just for that strategy, but others that people might encounter, whether they're in a large urban setting like Houston, or a more rural setting such as Panhandle, or smaller towns in the Panhandle, or in Central Texas, where it's not quite a small state college, but it's still got a substantial thing to some barriers to overcome. What are you seeing in the literature or your experiences that are some barriers that might need to be addressed?
Yeah, and that's a good question too. This is where I think it's always really important to have multiple stakeholders or people like with different backgrounds on board. I just recently wrote a paper with like a kind of a planner urban design guy where we looked at what are some of the influences on bicycling specifically. And we went back and forth, oh, like, what are we going to focus on and things like that. And he was like, oh, the environment, the environment, the environment. And I'm like, as the public health researcher, I'm like, well, no, like, active travel is a behavior. So there are still things inherent to the individual. That's things like self-efficacy or self-confidence for one's ability to ride in traffic, um, enjoyment, previous experience, um, and social norms, right? Those are all factors that are very behaviorally driven, that are modifiable, right? Sometimes we can't modify the environment, but we can maybe modify the way the individual thinks about the environment or interacts with the environment, right? I mean, ideally, we'd like to be able to modify the environment as well, but sometimes it's a little bit of a slower moving entity. So, you know, having skill-based classes to help people gather confidence, gather knowledge, have peer mentorship programs. There's some great examples of a couple of universities that I've seen, because university, common destination, a lot of people coming from from a surrounding community and things like that. Hey, those of you who live in this neighborhood, so and so is going to meet at the corner of this street and this street and show you the best way to bike into campus with, staying off the main roads and things like that, right? Peer mentorship programs, really super effective to do those kinds of things. So, and they help to address some of those barriers of confidence, of kind of creating that social norm,
Yeah.
that we know are just as important as the environmental pieces. So, some of the, tactics and strategies that we talked about were very much about creating an environment, with that idea of like, if we build it, they will come. But, I always like to, wave my public health hat around and say, we still need to encourage them to come, beyond just building, just building the pieces. So thinking about the barriers, they are oftentimes very diverse and wide and things like that, and do have, interaction with other sectors, right? Education sector, right? If we wanted to put together a walk or bike to school campaign, schools have to be okay with students walking and biking to school. The employer, business and industry sector, right? There are a million reasons for businesses to invest in active transportation, but they have to see value in it themselves. So, and sometimes having an employer or a school not being on board can also create barriers for individuals themselves. So,
Yeah,
very long
terrific.
answer.
I was particular. No, that's great. Again, if anyone has any questions, please post them in the chat. But I'm also interested in. Well, there's one right now. Can you share some examples of how we can influence the use of public transportation? Any data on? And I was about to ask that. So, is there magic pixie dust that is an accelerant that might speed up some of these particular strategies, and maybe use the
Yeah,
public transport as an example? I do know in Austin, for example, I'm privileged as an employee of the university, but the university pays for my ability to use the metro system as an economic incentive.
right. Well, I think I've done enough studies looking at what influences people's decisions on why they travel in a particular way to know that time and money are probably two of the most biggest driving factors in terms of influencing why people choose to commute the way that they do. I think in terms of selling public transportation, I think, we've done a couple studies out there that say that basically if all people ever do is walk or if all people ever do is drive to a destination, they have absolutely no idea how long it takes to walk or bike there. And that I think also holds true for public transportation in terms of if people don't ever take public transportation, they have maybe misconceptions surrounding what how long it's going to take, what the process is like, is it efficient, those kinds of things. So it's really about that kind of education piece. One of the things that we did here in our town is some of the local apartment complexes for students, and I realize students are kind of a different group, but I think it speaks to that whole knowledge thing. The apartment complex is about a mile and a half away, but the apartment complex gives people a bus pass to get to campus. So
Right.
if they people assume that that's the only way that you really can get to campus. It has to be you have to get on the bus to get there and things like that. And then we started doing some outreach efforts in that area and telling people that it actually only takes you about 25 minutes to walk from where you are right now. And you don't have to wait for the bus, and the bus is always crowded here anyways. It's just a different story type of thing. But it was an example, and we saw an increase in people walking, biking from that particular complex just by giving them the information and kind of clarifying how long things are going to take. So I think that, it's providing those pieces of information. Now, sometimes there's some equity access pieces that go along with public transportation as well, in terms of lack of connectedness or inconvenient schedules and things like that. And that's maybe where bringing transportation authorities on board to talk about how they can better interact with different neighborhoods or communities or things like that would be really helpful. Maybe bringing up that multimodal conversation would be good there as well.
Yeah.
So,
Great strategies. Well, we're right at time. I want to be respectful, certainly of Melissa's time, but also everyone here. Thank you all very much for joining. If you check the chat box, there are some links, particularly to the previous and upcoming webinars. This is being recorded, and we'll post the slides accordingly. There's also an email address on the screen, activetexas2030@uth.tmc.edu. That email comes directly to me. I'd love to hear from participants about what's going right, what's going wrong in your communities. Any questions that we might be able to highlight as we work towards renovating is what I'm calling our state physical activity plan to make it more sector specific. But thank you all very, very much. And Melissa, thank you for sharing your expertise. Such a vast topic. We could be here all afternoon talking about some of these particulars. So it was a terrific, a terrific overview. We very much appreciate it. Everyone have a great afternoon.